Are you gaining weight even though you work out? Snapping at your partner for no reason? Exhausted by 3 p.m.? It's not just stress or getting old. It could be low testosterone, and it's affecting millions of men over 30 silently. But here's the good news, it's fixable. I'm NeighborhoodDocB, and today I'll show you what's causing it, how to test it, and how to fix it, naturally or with expert-guided therapy. Drop reset below to get my free 7-day metabolic reset guide. I've seen it too many times. One patient, 38, works full-time, 3 kids, no time to breathe. He came in thinking he was just burnt out. His testosterone, 260. It's not aging, that's hormone dysfunction. He thought it was just life, but it was a biological breakdown, and we reversed it. Here's what they're not telling men. Testosterone doesn't just age out, it drops faster when you're stressed, inflamed, sleep deprived, or overweight or obese. And here are low T symptoms: fatigue, irritability, brain fog, depression, decreased strength and endurance, belly fat, low libido, sleep problems. It's also tied to high blood pressure, insulin resistance, cardiovascular risk, and yes, osteoporosis. And here's what's wild. 40% of men over 45 have low testosterone, but most never get tested. Let's talk science. Testosterone production starts in your brain. The hypothalamus sends out GnRH. GnRH signals the pituitary to release LH. LH tells your testicles, specifically the Leydig cells, to make testosterone. But as you age, GnRH declines, Leydig cells become less responsive, inflammation blocks hormonal signals, chronic illness and obesity suppresses the system. Medications like opioids, corticosteroids, and even marijuana can lower T. And guess what? Even environmental toxins like BPA in plastics can mess with this axis. And here's a testing breakdown. 2 early morning total testosterone tests are essential, ideally before 10 a.m. Between 7 and 10, that's when the testosterone is at its highest level. If levels are less than 300 nanograms per deciliter with symptoms, that's clinical low T. But always test total T, free T, SHBG, LH, FSH, estradiol, prolactin, hemoglobin hematocrit, TSH, and also include a PSA if over 40 or have a family history of prostate cancer. And if levels are very low, less than 100, you may need pituitary or testicular imaging. Here's how you can naturally improve your testosterone starting today. Strength training 3 times a week. Lifting weights is one of the best ways to naturally stimulate testosterone. Clean up your diet. Prioritize lean protein, healthy fats, and cruciferous veggies. Cut sugar and processed carbs. They spike insulin and lower T. Optimize sleep. Aim for 7 to 9 hours. Deep sleep equals peak testosterone production. Reduce belly fat. A 10% weight loss can significantly boost your testosterone. Address stress. Chronic cortisol blocks testosterone. Practice breath work, daily walks, and limit caffeine. Supplement wisely. Key nutrients: vitamin D, zinc, magnesium, ashwagandha, omega-3s. Now let's talk TRT, or testosterone replacement therapy. If your levels are truly low and if you failed lifestyle changes, TRT may help, but it's not a magic pill. TRT is individualized and must be monitored closely. Here are different forms of TRT. Gels, topical, easy to use, affordable. Injections, weekly to monthly, they're also affordable. There's patches. Other options, but are expensive, there's oral tablets, intranasal sprays, and pellets. You must follow up after starting TRT, labs at 6 weeks, 3 months, 6 months, and then twice a year. Monitor your CBC, estradiol, PSA, lipids. And here are some possible side effects: acne, hair loss, fluid retention, increased blood cells, which is called polycythemia, suppressed sperm counts, testicular atrophy, gynecomastia, sleep apnea. And make sure to use TRT safely. Avoid community clinics or unregulated supplements. There was a key study that just came out, transverse trial, which showed TRT was non-inferior to placebo in cardiovascular risk for high-risk men and no increased risk of prostate cancer. TRT is not for everyone, but for the right man, and can be life-changing. Most men don't realize that it's not just aging. Here are top causes of low T in men 30+. Aging, obesity, especially visceral fat, diabetes and cardiovascular disease, aka chronic diseases, opioids and corticosteroids, high cortisol, aka stress, nutritional deficiencies, lack of strength training is just key. Testosterone is the canary in the coal mine for your overall health, and if it's low, something's off and it's time to fix it. You don't need to accept fatigue, mood swings, and weight gain as normal. You can be strong, focused, and energized again, but only if you start now. Comment reset below and I'll send you my free 7-day reset guide. Like this video if it helped you. Subscribe if you're ready to build a stronger you. And share this with a friend who needs this information now, not years from now. Talk to you soon.